Today on Doctor's Care, we'll explore how healthcare services are delivered outside the urban centers, where the medical clinic and hospital are in your community and members of your medical team might live just down your street. We'll meet a few kindly country doctors who deliver compassionate care and a wide range of services to their patients. They need to be generalists, versatile and flexible, but they all agree treating their patients by providing checkups through diagnosis and testing to following them through treatment and recovery is a privilege. Now, when we first got this assignment, we thought we were going to hear about the challenges of rural medicine, how access to services were limited, and that people living in smaller centers were disadvantaged when it came to their health care. What we found were medical professionals who absolutely love being part of their communities, delivering care to friends and neighbors. We were struck by their dedication to their patients and their enthusiasm for their rural lifestyle. In fact, they wouldn't have it any other way. We traveled to Souris, Manitoba to meet Dr. David Cram, to visit with the staff of the medical clinic and the hospital, and to get a glimpse into today's rural healthcare facilities. When did you first know you wanted to be a doctor?
Good question, you know. I had a lot of role models in rural Manitoba, and I, for some reason, decided that that's what I wanted to do early on in high school, you know, and that was it. And I wanted, I saw the doctors in rural Manitoba dealing with, when I broke my collarbone 3 times, when my parents were ill. It's just something that appealed to me, and I wanted to do it in that setting as well.
At any time when you were in university, did you think you might take a position in the city?
I grew up in rural Manitoba and as a country kid, and that's really where I wanted to go.
So let's talk about that a little bit, about what a day in the life of a physician out in rural Manitoba is like.
Well, it's busy. I love it. You're really involved in the full aspect of medicine. I'm working here in the office, then I'm at the hospital in the morning, then I'm back up at the hospital at noon, and then at night I'm on call often. So you're looking after everything. That's sort of the full service aspect of things, and it's so nice to go up to see someone in the hospital that you've known for 20-some years, and it's not like somebody new to you, so you know all their medical problems, and when they come in the middle of the night and they have a heart attack or they're sick or something's going on, you know them, their past history, their family, and it just worked for me, and I think it works for them too, and that's such a great thing.
That's very satisfying for you.
Very much so, you bet. Norm and I have known each other a long time. And don't tell any stories.
No. Can't say what I'm thinking.
Tell us a little bit about your quality of life with your family living here.
I hate rush hour traffic. It drives me crazy. And it's nice. Like, I'm 2 minutes away from the hospital. You walk down the street, you know everybody, and that's okay. It's a positive relationship you have with most people, and it's just nice.
Roxy Kowalchuk manages the Souris Clinic.
I've been working here at Souris Medical Associates for 15 years, and I feel this is an ideal job for me to have, living in the community of Souris and raising my family here. I feel very fortunate to have this job.
What do you see as the advantages for the medical care living in a rural community?
I think that physicians have a very deep relationship with their patients here. Not only are they caring for the patients that live and reside in the community, but they also know them and can see them outside the medical office, whether they see them at the community center or uptown walking. It's a deeper relationship, I think, than a city physician, for example.
I imagine they have a lot of respect for you.
It was pretty rough around the edges when I came here, and I'm sure there was a maturation process. I'm not perfect, but I try the best I can, and I think it's a mutual respect. You're respecting their lives and the impact that illness and diseases have had on their lives, and so it's nice to be able to help them with that.
Dr. Cram might be just a little overly modest. We met a few of his patients who were happy to share their opinions on his standard of care. Josephine Carswell is 98 years old. This lovely lady has seen her share of medical issues, but feels well served by her community medical team.
I married my high school sweetheart, and we lived most of our life in Morris, Manitoba. I had twins, a boy and a girl. We were married in 1938, and the twins were born in 1940.
Sadly, Josie's husband died much too young at 47, and in 1981 she moved to a little place in Souris to be near her daughter's family. So can you tell me about your health care out here in Souris?
I had Dr. Cram, a doctor for a number of years. He's been very good to me. 2 years ago, I fell and broke my hip, and I had another serious heart attack. And Dr. Cram seen me through that, and I swear by him. I always feel so comfortable with him. He's very sincere. Thank you, Dr. Cram, for all your kindness to me, for being there when I needed you. I couldn't ask for anybody better. Thank you so much.
I don't mind getting older, and it's important to stay active. I'm getting closer to retirement. I have grandchildren that keep me busy, and I play badminton twice a week. My massage therapist takes the time to talk to me about my medical history. I never feel rushed. I describe my massage therapist as compassionate and caring.
Take time for your registered massage therapist.
In addition to the medical clinic, Souris offers a fully functioning hospital, complete with a 24-hour emergency service.
Hey, Ross. Can we come in while he's eating, or? I don't see why not. Sure. Got the entourage. I've got my friends with me.
Oh, okay.
How you doing today?
How many patients do you see on an average day?
Typically, I'll have anywhere from 6 to 10 or 12 patients in there myself. There's 4 physicians here, so we've got a fully functioning emergency department. So not only do we work here, we cover the emerge as well, and so it's a busy little hospital. So you've another few more weeks of the intravenous antibiotics, and then oral antibiotics, and you get to go home.
Yeah.
Yippee!
I'm home this afternoon for a bit.
Sounds good. Okay. Well, good seeing you, and we'll see you tomorrow again then.
Alrighty, you bet.
You get a lot of variety, obviously.
Tremendous, and that's what rural medicine's all about. Whatever comes in that door, that's what you're looking after, and that's what makes it very challenging yet interesting. 2 weeks ago, we had a big motor vehicle accident. 2 people came in head-on accident. We deal with that. We call all the doctors in, all the nurses came in, and heavens and medical record staff for helping cleaning up. And it's just nice to be part of that team. Heart attacks, sick kids, sick babies, lung disease, accidents, broken bones, everything. And that's what I really, really enjoy. I really enjoy that mix, and I enjoy being able to see people in the office, and then say I see someone this afternoon who's quite ill and requires to go up to the hospital. Well, then I'll be admitting them and I'll be looking after them, and I'll see them tomorrow morning in the hospital. And that's just what I find very fulfilling and very challenging.
It feels to me like a throwback to the way things used to be, or the good old days.
It is to some extent, yes. Certainly the days of every doctor doing surgery and taking people's tonsils out on the kitchen table are gone, but it certainly is. In rural medicine, you're more on your own. We rely on backup a lot and talk to specialists a lot for advice and things, but generally speaking, we're looking after the patient, and that's what I like. It's great.
Ross May puts his faith in Dr. Cram. A few years ago, Dr. Cram helped determine the cause of his severe migraines.
But Dr. Cram figured it out that it was the caffeine, and then he sent me to a specialist just to confirm his. And sure enough, that's what it was. I quit the Coke and Pepsi, and I've been good ever since. Had a few warning signs here and there if I eat too much chocolate or something, but other than that, it's been great.
So that really changed your quality of life if you had migraines. They were quite debilitating.
Oh, they're terrible. Sometimes I just wanted to lay and die,
How do you feel about the care here at this hospital?
It's excellent. You couldn't get better care anywhere. The nurses are terrific, doctors, everything. I've been here for a month now pretty much and haven't complained. I know I'm in the right place.
Penny Gilson is the Chief Executive Officer for the Prairie Mountain Regional Health Authority. One of her important tasks is the recruitment of doctors and other allied healthcare workers to this region. Can you tell me a little about the personality traits that you see in healthcare workers who choose a career in rural Manitoba?
It takes special people to work in healthcare to begin with, but when you come to practice in rural Manitoba, using physicians as an example, they provide the full continuum of service in rural Manitoba, so they care for their patients in their clinic, they care for their patients in the ER, they care for their patients in the hospital, and they care for their patients in the personal care home. So they provide that full continuum of service, and I think that's what the type of people working in these types of health centers feel, is that they're caring for people they know and work and live with every day, and that is an extremely rewarding experience for them.
An example of what rural healthcare can be like, Reg Lang was calling an auction at a fundraiser for a little girl who had cancer. He started not feeling well, but chose to walk the 2 blocks to his home. Dr. Cram had been in attendance at the auction, but Reg didn't want to bother him with what he thought was a minor health complaint. Now you're not feeling well, and I understand you chose to walk down Main Street just in case.
Yes, yeah. I was dumb when they were sitting there. I could have said, "Oh, I'm not feeling very well, give me a ride home," but I thought, I never thought of it being that, even though I'd had a heart attack, years before, it was in the 1970s. So, but, yeah, and so when I got home, I crawled in and laid on the floor for a while, and then finally was able to wake Jean up and told her she better get an ambulance. Yeah.
Now you've arrived at the hospital here in Souris, and Dr. Cram has been called.
Yes.
You took one look at him and said, "Gee, I just saw you at the hockey arena."
Right, yeah. He kind of joked to me about, "What are you doing here?" And I said, "Well, that's for you to find out."
Dr. Cram or the people at the hospital arranged for you to go to Winnipeg. Did you go by ambulance?
Yes, yeah. Went straight to St. Boniface Hospital, and then I had a quadruple bypass.
So you had a quadruple bypass, and then what's your life like since then?
Been very good, really. I'm able to golf. I try to golf, but it's been good, really.
I'm Bill, and really this story is quite good. I was in the backyard just fooling around in my pond and whatever, and I went to get up and got a little dizzy and a little whatever, and so I went in the house and said that I wasn't feeling so hot. And Dr. Cram had been on holidays and I wasn't sure whether he was home or not, but the wife wanted to phone Dr. Cram. I said, "I'll leave him alone, he's on holidays, I just had a little bit of a spell." So I said, "I'm going to rest for half an hour." And after about half an hour, I wasn't doing too well. And so my wife decided, or took it into her hands, to run across the lane and get Dr. Cram. That's what a small town is all about. He came over and you up to the hospital. Well, up we go to the hospital, and I don't know what they do up there, but they do something up there after you have a heart attack. And within, I would say, an hour or an hour and a half, he got me calmed down and sorted out in the ambulance and on the way to Winnipeg. And for that, I'm very thankful, really. And to me, that's what a small town, with the doctor here, and him across the street. He's not much of a poker player, but anyway, that's part of the story.
You're on your holidays and you're home and the phone rings. Was that what happened? The phone rang? Or?
You bet, yes. And what else would you do? Bill's a dear friend, and I've known him for many years. Again, it's a rural town and someone needs some assistance, so sure, I'll be glad to help. And that's sort of something I alluded to earlier, is, that's part of the privilege of being able to be part of the system and help individuals that need it. And it just works. It's just real great. Just glad to do it, simple as that.
I think he also got paid.
Yeah, but nothing extra for the holiday pay.
Yeah, I know, okay.
Bill's a retired accountant too.
Tell us about your surgery.
It was interesting. When I got in there, it turns out that the surgeon had gone to school with Dave. And so he came, did all the tests, whatever. And he says, "Can't do the operation, your lungs are too bad." So we called in a lung specialist and can't do the operation because your heart's too bad. So that went on for 3 or 4 days, and all the meantime, Dave was phoning in. How's Bill? Can you get him to do this, do that, or whatever he does, the heart doctor. And he kept saying, Dave phoned twice today. Dave phoned 3 times today. I said, don't let him cheese you off. I mean, I got to keep you guys on my side. But anyway, eventually on the 4th day, they did their tests and decided that they could do open heart surgery. It worked out. It just was the way it was handled here, getting to Winnipeg and the referral and whatever. It makes sense to have good friends and good doctors in small towns.
Healthcare is a big, complex system, and sometimes things happen that aren't planned. Here's something simple you can do to be safer as a patient. Make a list of your medications. Include any vitamins and herbal remedies, too. Know what your medications are for and what side effects you might expect. If your medication has changed, ask why. Finally, keep your medication list with you at all times. It's vital in an emergency. SafeToAsk.ca is a great place to find out more ways you can help make healthcare as safe as possible. Learn to be safe.
Deeply inspired by European traditions, the people of Notre-Dame-de-Lourdes strive to preserve their French culture. As such, they proudly offer health services in both official languages. Village leaders have worked diligently to strengthen the medical team and the facilities which service a wide, predominantly agricultural area. 25 years ago, the community welcomed Dr. Denis Fortier. Not only has Dr. Fortier served as a committed and compassionate family physician in the town, he has also been involved as part of a fundraising team responsible for significantly expanding medical services. For his contributions to the community, Dr. Fortier was recently recognized as the 2013 Physician of the Year in Manitoba. You grew up in the city. What was it that attracted you to Notre Dame?
My dream, even when I was younger, was to be a rural family physician. Even though I'm from an urban setting, I have no idea why I had that romantic thought, but I did, and pursued it again. During medical school, I had visions of doing other things, pediatrics, obstetrics, internal medicine. In the end, I liked everything. And because I liked everything, I figured there's only one way I can do everything is to be a family doc. Marcus Welby was on TV at the time.
While Dr. Fortier originally planned to be in Notre-Dame-de-Lourdes for only 2 years, he found he loved the community and he chose to stay ever since.
The rural lifestyle is really amazing. It's very safe, right, to raise your children. The sense of community, I don't know how I can explain it. That's one thing that I fell in love with, was just this whole sense of being part of a community, and we're all sort of thinking the same.
Paul Senarini is a retired teacher who sits on the board for the local regional health authority. He worked closely with Dr. Fortier on building community and then provincial support for the expansion of medical services in Notre Dame.
From a global perspective, of course, in this community we felt that we needed to replace the hospital, which is probably the oldest or second oldest hospital in Manitoba. But it's not as simple as that, because hospitals provide acute care, whereas if we look at a total system, we need to start with a primary health care. So we decided to do I guess a deep reflection on our health system and how a health system should be constructed to better serve the needs of the community.
The community rallied round the project, participating in fundraising events and providing corporate sponsorship.
You'll see that we did get some money from private foundations also. Even the Winnipeg Foundation gave us money, and they usually don't give money outside of Winnipeg, but this was an exception, so we're quite happy with Mr. Frost.
A testament to your planning and your presentation, I'm sure.
Thank you. One of our main inspiration sources, I guess, was Dr. Fortier.
I sort of realized that we could do a part of the vision, and that part of the vision was a primary care clinic, primary care building, if you will. And when we pitched this to the community, they absolutely loved it. They backed it up unbelievably, and we moved into this wonderful new facility about 5 or 6 years ago. So that was what we called phase 1, but we still had our eye on the prize, a new hospital.
We recognize here that if you're going to be a healthy francophone, you need services in your own language. And I guess that Notre Dame is probably the center in central western Manitoba that can provide those services.
One of the things that attracted me to this community was the bilingual community, and I'm French speaking, and it's easy to lose the language if you don't use it. So I felt I'd love to offer my services in a bilingual community. This raises a whole bunch of other issues throughout my life about whether or not we needed French or bilingual services for our population. So I've been very vocal, as have others, in terms of the primary care center for Francophone people, an acute care center for bilingual people. And it just seems to grow from there.
I asked Dr. Holly Hamilton about being a doctor in a rural community. One of the things about working out here is that you get a lot of variety in the services that you provide, I would guess.
Absolutely. Everything, full spectrum. One day you are delivering a baby and you get to hear that first cry, and then you're sitting with a family and you're watching the last breath. And everything that you can imagine in between is there. And again, that is it's amazing. It's just amazing.
When you deliver a baby as an example, you still feel a great sense of privilege for doing that, from the sounds of it.
It's a miracle. Like, there's 4 people in the room, and then all of a sudden there's this 5th. And I'm getting goosebumps even just thinking about it, because it is the most absolutely amazing experience. You've grown with the family. I've been here 3.5 years. I've been there when, we've heard you just got married, and then I've delivered their baby. Gone through their prenatals and all the stuff that goes along with it. So I can only imagine in 20 years or 30 years, maybe being able to see their grandchild. That's just amazing. Dennis has delivered, and Fran too, have delivered generations, and I just think, how cool is that? That there's nothing wilder. Nothing. The detriment of being here, I find, is the anxiety associated with, if a car accident comes in, you don't know who it might be. And that just petrifies me. It's petrifying, because you're it. You've got a great team with you, and we've got some of the best and most fantastic nurses ever. But whoever's in that room, that's it. You don't have that person just next door to call down, or the one upstairs to come down and intubate or do anything like that. You're it.
I asked Dr. Fortier if he had a story, one that could illustrate one of the larger differences of working in a rural community, where your patient is often someone you've known well.
I had a student here once, and a patient came in, brought in by a passerby. He hit a train with his vehicle. It was a foggy night, hadn't seen it, hit the train. When he came in, the student was checking out this person, and basically a little bit of pain along the chest and abdomen, but otherwise looked fine. Blood pressure was good. And so I asked the student, could you repeat that for me? What did you say about the blood pressure? And she said the blood pressure is good. And I said, well, you better put 2 big intravenous's in this person. She says, well, why? I said, I know this patient. This is one of my patients. His blood pressure is always high. There's no way that his blood pressure should be normal after hitting a train. And so we put 2 big intravenous's in, and sure enough, he had ruptured his spleen and had bled 1 or 2 liters of blood into his belly by the time he was seen by the surgeon. So that was knowing the patient. I knew who this person was. I knew what his blood pressure was.
Your patients, whether you're delivering a baby or anything, must have such comfort knowing how much you care. It just comes across so clearly.
I hope so. Although really in a community this size, and everybody takes care of everybody. And so, I think they equally take care of us. So it's reciprocal. It's definitely reciprocal. These are not just patients. They're not just clients. They are my banker. They are my mechanic. They are my friend. They are my vet. Honestly, medicine, I have seen some people turn medicine cold and harsh. And even though it's one of the hardest things to ever do, I still go home and cry. And I will cry with my patients, and I don't mind doing that. And I'm proud that I'm able to do that and not just toughen up and be cold. I like the fact that I'm able to be warm and sad and happy when they're happy and sad when they're sad.
The people of Notre Dame feel very lucky to have such compassionate care in their corner and available in both official languages. And Dr. Fortier, well, he's made quite an impact on his co-workers and his community.
I'm just going to freeze. That's always not much fun. Hurts a little bit for 2 seconds. Poke.
Yes, he has won many awards. I always tease him a little bit. I'm asking him if he's built a little showcase in the back of his house there, and if he's got a storage room that's large enough for all his awards. But it doesn't go to his head, and he doesn't work with the goal of winning those awards. But his results and his approach have been recognized as extremely exceptional, I guess. So that's why he's had those awards.
Dennis, honestly, I call him the rock star. I say, Dennis, you're the rock star. And not only because he used to have a mullet and an earring and wore leather ties and everything. He really is this rock star. He has been my mentor since my first year of med school. And I've had a couple difficult situations where I didn't know who to turn to. And he was one of the people that I talked to.
Is there one thing that you're most proud of?
I think, besides my kids? I'm very proud of my children, of course, and they turned out to be wonderful young adults. But I think we've built something here in the community that wasn't there 30 years ago. And to the point where it's almost taken for granted. And that's okay. I love the fact that the care that people are getting here is almost taken for granted, because it means that it's been sustainable for so many years. And I think I'm at the point now where I would need to think about building it even more. So myself and others we're dreaming about the future and about attracting even more people here to make this truly sustainable and growing some more.
We've seen that healthcare in rural Manitoba is alive and well, with compassionate people who love delivering exceptional caring service to their patients. And it's this dedication to the traditions of the Hippocratic Oath, the humanitarian goals of medicine, that shines through, not only in Souris and Notre Dame de Lourdes, but in communities across Manitoba.